everyone. How you doing? My name is Ryan. I'm coming from my lovely abode here, and trying to do my nice little video for the assignment for psychopathology. YouTube was acting up for me, and so just decided to hop on this phone and see if I can give this a go. Um, First off, I really just want to point out that this assignment was pretty awesome in the fact that um, you get to analyze a person's point of view through their writing and through their works. Talk about their life with a mental disorder or a certain psychopathology. And the story that the autobiography I decided to do the midterm on was Girl Interrupted. And first, I didn't really know what I was getting into. And when I figured out by doing a little background research before reading the book, when I figured out it was about BPD and borderline personality disorder, I knew that it was something I wanted to dive into. During my undergraduate studies, I've done some research on BPD, and it's a very, very interesting pathology, and I think this book really got me into the front seat of what it's like to have these sort of symptoms present in your life all the time. And the book was pretty much, it was a wake-up call for me. It was written by Susanna Kaysen, and written in the 1960s, so it was an interesting era that this book was written in. And I found a lot of extensive research on this topic of BPD. I've also read some books in the past on the disorder. However, what was really nice about this midterm was that in reading the autobiography, you could really point out and see the crucial symptoms, and even looking at the DSM, the diagnostic criteria for BPD. This idea of being abandoned. This idea of not having an identity, very, very impulsive like behavior, and acting without critical thinking. When I was doing the research for the midterm, there was a interesting YouTube video by a psychologist professor named Jordan Peterson, and he named it the female variant of antisocial personality disorder in men. And I did agree with that a little bit, but mostly I disagreed with it because there are some differences that we do see with the antisocial personality in men, and I've seen it in women as well. So it would be interesting to see how many. To do some research and studies on how many have BPD as far as like the genders are concerned, male and female. But I really did like this midterm. There was just an extensive amount of research based on the fact that it's such a confusing disorder, and it's hard for therapists and clinicians to diagnose. And it's one of those things where it's something that has to be treated on a daily basis. And they, as far as causation is concerned, there wasn't really, a set on causation for this disorder. It was mainly correlations between, they found some biological things in individuals with BPD as far as the hippocampus and the amygdala as far as being smaller in size than to normal people that do not have BPD. But they also did state that this could be cause of environmental factors, and the nature and nurture debate really came into play in this midterm. Somebody is not just born with BPD. It's something that happens over time, and it's based on the fact that a person, the symptoms gradually increase over time, and basically how you live your life, as far as lifestyle changes, lifestyle decisions, be it substance abuse. How do you solve your issues? How do you solve your problems? This story was really good. I really liked the autobiography. There was a couple events and instances in the story where the suicidal ideations of one of the pieces of the criteria for BPD was prevalent, and it actually made me went and go watch Girl Interrupted, the movie. And the movie kind of, I think, dramatized the book. I think that's for anything, but I really could relate the book to the movie, but I really did like reading the book and then figuring out the research and finding some very, very rational findings on this disorder. And it's definitely something that I would like to dive into more in the future, as far as maybe a possible thesis, or papers in the future. So yeah, that was my midterm. A great book. I really do suggest that you guys give it a read, and it really does open your mind to different diagnoses, different channels of diagnosis that as a clinician you could use beneficially to your advantage to analyze a client and really figure out what the issue is for a specific client, and practicing individualized therapy. So like I said, it's a great book. It was a great midterm. I really do like this class, and I'll see you guys on the discussion post. Thank you.